Lyrica is a medication that is commonly used to treat conditions such as seizures, nerve pain, and anxiety. It is classified as an anticonvulsant drug that works by reducing the number of pain signals sent by damaged nerves in the body. This medication is available in the form of tablets and capsules, and it is important to use it correctly to ensure maximum effectiveness and minimize any potential side effects. In this video, we will explore the uses, dosage, and potential side effects of Lyrica, as well as some precautions and alternatives. What is Lyrica and how does it work? Lyrica, also known by its generic name pregabalin, is a medication that is used to treat a variety of conditions. It was first approved by the U.S. Food and Drug Administration, FDA, in 2004 for the treatment of neuropathic pain associated with diabetic neuropathy, postherpetic neuralgia, and spinal cord injury. It is also used to treat seizures, fibromyalgia, and generalized anxiety disorder. Lyrica works by binding to a specific type of calcium channel in the body, which reduces the release of neurotransmitters that transmit pain signals to the brain. This results in a reduction in pain and other symptoms associated with conditions such as neuropathy, fibromyalgia, and anxiety. Common uses of Lyrica. Lyrica is used to treat a variety of conditions, including neuropathic pain. Neuropathic pain is a type of pain that is caused by damage to nerves. It can be caused by conditions such as diabetes, shingles, or spinal cord injury. Lyrica is often used to treat neuropathic pain, as it can help reduce the intensity of pain and improve overall quality of life. Seizures. Lyrica is also used to treat seizures in people with epilepsy. It can help reduce the frequency and severity of seizures, which can improve overall quality of life. Fibromyalgia. Fibromyalgia is a condition that causes widespread pain, fatigue, and other symptoms. Lyrica is approved for the treatment of fibromyalgia, as it can help reduce pain and improve sleep. Generalized anxiety disorder. Lyrica is also used to treat generalized anxiety disorder, a condition characterized by excessive worry and anxiety. It can help reduce symptoms such as restlessness, irritability, and difficulty sleeping. Dosage guidelines for Lyrica. The dosage of Lyrica will vary depending on the condition being treated and other individual factors such as age, weight, and overall health. It is important to follow the dosage instructions provided by your healthcare provider to ensure maximum effectiveness and minimize the risk of side effects. For the treatment of neuropathic pain, the recommended starting dose of Lyrica is 50 mg 3 times daily, which can be increased to a maximum dose of 300 mg per day. For the treatment of seizures, the recommended starting dose is 75 mg twice daily, which can be increased to a maximum dose of 600 mg per day. For the treatment of fibromyalgia, the recommended starting dose is 75 mg twice daily, which can be increased to a maximum dose of 450 mg per day. For the treatment of generalized anxiety disorder, the recommended starting dose is 150 mg per day, which can be increased to a maximum dose of 600 mg per day. It is important to take Lyrica at the same times each day, with or without food. Do not crush or chew the capsules or tablets, and do not stop taking Lyrica without first consulting your healthcare provider. Potential side effects of Lyrica. Like all medications, Lyrica can cause side effects. The most common side effects of Lyrica include dizziness, drowsiness, dry mouth, and constipation. These side effects usually go away on their own within a few days or weeks of starting treatment. More serious side effects of Lyrica can include difficulty breathing, swelling of the face or tongue, and rash or hives. If you experience any of these symptoms, seek medical attention immediately. Precautions and warnings when taking Lyrica. Before taking Lyrica, it is important to inform your healthcare provider if you have any allergies, medical conditions, or are taking any other medications. Lyrica may interact with certain medications, including opioids, benzodiazepines, and other medications that cause drowsiness. Lyrica may also cause dizziness, drowsiness, or blurred vision, which can impair your ability to drive or operate heavy machinery. Avoid driving or operating heavy machinery until you know how Lyrica affects you. Lyrica may also increase the risk of suicidal thoughts or behavior in some people, especially those with a history of depression or other mental health conditions. If you experience any changes in mood or behavior while taking Lyrica, contact your healthcare provider immediately. Interactions with other medications. Lyrica may interact with certain medications, including opioids, benzodiazepines, and other medications that cause drowsiness. It is important to inform your healthcare provider of all medications you are taking, including over-the-counter medications, supplements, and herbal remedies. How to safely stop taking Lyrica. If you need to stop taking Lyrica, it is important to do so under the guidance of your healthcare provider. Suddenly stopping Lyrica can cause withdrawal symptoms such as anxiety, insomnia, and nausea. Your healthcare provider can provide you with a tapering schedule to gradually reduce your dose of Lyrica and minimize the risk of withdrawal symptoms. Frequently asked questions about Lyrica. Is Lyrica addictive? Lyrica is not considered to be addictive, but it can cause physical dependence in some people. It is important to follow the dosage instructions provided by your healthcare provider and not to suddenly stop taking Lyrica without first consulting your healthcare provider. Can Lyrica be taken during pregnancy? Lyrica is classified as a pregnancy category C medication, which means that it may not be safe to take during pregnancy. It is important to inform your healthcare provider if you are pregnant or planning to become pregnant before taking Lyrica. Can Lyrica be taken with alcohol? Lyrica should not be taken with alcohol, as it can increase the risk of dizziness, drowsiness, and impaired cognitive function. Alternative medications to consider. Gabapentin. Gabapentin, also known by the brand name Neurontin, is an anticonvulsant medication similar to Lyrica. It is commonly used to treat neuropathic pain, seizures, and restless leg syndrome. Gabapentin works by modulating the release of certain neurotransmitters involved in pain transmission. It may be a suitable alternative to Lyrica for some individuals. Cymbalta. Cymbalta, also known by its generic name duloxetine, is a medication that belongs to a class of drugs called selective serotonin and norepinephrine reuptake inhibitors, SNRIs. It is primarily used to treat major depressive disorder, generalized anxiety disorder, and certain chronic pain conditions, such as fibromyalgia and neuropathic pain. Cymbalta may be considered as an alternative to Lyrica, especially for individuals with comorbid depression or anxiety. Tricyclic antidepressants. Tricyclic antidepressants, such as amitriptyline and nortriptyline, are medications that have been used for many years to treat various conditions, including neuropathic pain. They work by inhibiting the reuptake of serotonin and norepinephrine, leading to increased levels of these neurotransmitters in the brain. Tricyclic antidepressants can be considered as alternative options for individuals who do not respond well to Lyrica. Topical medications. In some cases, topical medications such as lidocaine patches or creams may be used to alleviate localized pain associated with conditions like neuropathy. These medications work by numbing the area where they are applied and can provide relief without the systemic effects associated with oral medications. Conclusion. Lyrica is a medication that is commonly used to treat a range of conditions, including seizures, nerve pain, and anxiety. It works by reducing the number of pain signals sent by damaged nerves in the body. It is important to follow the dosage instructions provided by your healthcare provider and to watch for potential side effects. If you experience any changes in mood or behavior while taking Lyrica, contact your healthcare provider immediately. There are several alternative medications that may be used for the treatment of neuropathic pain, seizures, fibromyalgia, and anxiety. It is important to discuss your treatment options with your healthcare provider to determine the best course of treatment for your individual needs. Thanks for watching.